Hi, my name is Minh-Tam, and today, myself, along with my group mates Diane and Suyash Rizal, will be looking into the psychosocial aspects of Duchenne muscular dystrophy. The first thing we're going to look at is an overview of Duchenne muscular dystrophy. What is it exactly? Well, Duchenne muscular dystrophy is an X-linked and recessive genetic disorder, and it causes muscle wasting. Basically, a mutation in the dystrophin gene, one of the largest genes in the body, causes a lack of dystrophin production, and it makes a person's muscles weak and prone to damage. And since Duchenne muscular dystrophy is X-linked and recessive, it most commonly affects boys and is early onset. Care for Duchenne muscular dystrophy so far is symptom management, but there are new and upcoming research and clinical trials for different treatments and gene therapies that may be useful in the future. But for right now, it is important to recognize how multidisciplinary care for diseases are, such as Duchenne muscular dystrophy, and that things such as the psychosocial approach should be focused on in order to ensure adequate mental health care for patients. To give a brief overview of what a psychosocial approach to care for Duchenne muscular dystrophy might look like, we can see these images in which there are stages of planning, adequate communication, proper mental health counseling and therapy, and other methods such as coping in order to ensure that the patient and their family um, are being treated for any potential psychosocial issues that may arise as a result of having to deal with such a complex disease. So in the next upcoming slides, we will be exploring the relationship between chronic illness and mental health. So studies show that about 20% of children in the US have some form of chronic illness. Chronic illnesses are illnesses that basically affect an everyday aspect of someone's life. So this means that these children who are affected by chronic illnesses have issues with not only their health, but can also have issues of the mind. And chronic illness does not only affect the patient, it affects their family, but although there are different ways that it would affect their family and siblings. So let's first take a look at how chronic illnesses would affect patients, and specifically Duchenne muscular dystrophy patients. The boys typically have to deal with side effects from medications, such as side effects from their corticosteroids or potential heart medications. And there has been shown that boys with Duchenne muscular dystrophy tend to have higher rates of neurological disorders. Not only this, but they also have to deal with pain and just life interruptions from having to be hospitalized or having to go to doctor's visits. And as the disease progresses, they do lose ambulation and there are physical limitations. A boy with Duchenne muscular dystrophy typically cannot run or participate in sports in the same way that his peers can. Along with this comes a loss of independence. As the disease progresses and ambulation decreases, Duchenne muscular dystrophy boys might have to use wheelchairs or power chairs and may even be on a ventilator to help them breathe. And with this comes a lot of unpredictability and instability, and fear, obviously, and perhaps even social ostracism due to an inability to participate in things that typical boys their age would. So when we look at family members related to a patient that has Duchenne muscular dystrophy, we see that they can have stress from worrying about their family. They can have stress from financial strain. They can have a lot of guilt and anxiety and depression, along with a lower quality of life and health due to all of these effects. We also see that there are increased mood disturbances and family arguments in families that have to deal with chronic illness. To look specifically, we see that in parents, some parents feel guilty about their child's condition because they're the ones that passed on the genetics. A lot of parents reported that stress for them peaked at moments in which they received bad news, especially at like life-changing moments where there's a diagnosis or loss of ambulation or need for ventilation. So basically, the impact of just having someone dependent on them can result in things like decreased sleep quality and decreased quality of life. Next, we'll be looking at a general overview for treatments for these psychosocial issues that may arise from Duchenne muscular dystrophy. So the first thing we're going to look at is therapy. And there are a lot of different kinds of therapy. The first therapy being cognitive behavioral therapy, or CBT. And cognitive behavioral therapy is a type of therapy in which patients can talk to counselors or therapists about their thought processes, and it seeks to help them become aware of how they think and how to reevaluate challenging situations in order to better adapt and solve their problems. There's also family therapy, which can be similar to cognitive behavioral therapy, except it includes multiple members of the same family and creates a neutral environment for them to discuss amongst each other their thoughts and emotions and helps them better process like as a family unit. Um, Lastly, problem solving therapy. The goal of problem solving therapy is to create healthy coping mechanisms and to understand emotions and create a plan to reduce distress. And problem solving therapy has been shown to be super effective in improving parental distress. Next, we're going to look at coping. And there are many multiple ways of coping mechanisms. So there are two main coping mechanisms, but each has like its own individual categories. So emotional based coping consists of using methods to regulate emotions. And this can mean that patients and their family can do meditation or yoga or relaxation or even sensory deprivation in order to like regulate their stress and emotions. Problem solving based coping consists of methods to deal with the situation itself. And this can mean better education on Duchenne and its effects. It could mean planning for possible progression of the disease and planning for treatment. And basically, problem solving based coping is just uh, is geared towards forms of action that can help with dealing with Duchenne. So the next remedy that can help with the psychosocial aspects of having DMD has to do with attitudes and positive healthcare encounters. Because someone with a chronic illness such as Duchenne will probably have to visit many different kinds of healthcare professionals and therapists in order to receive treatment. So hope and presentation of information is pretty important. Um, Many parents and patients have said that when their healthcare provider discloses information in a more like neutral way, it has been more fair to them and it has given like them hope and reassurance, and it's less distressing. So continuity of care is also important in that patients and their family receive uh, consistent communication whenever they have any questions or concerns, and that having a familiar team of staff, especially for pediatric patients, has helped them become more familiar um, with just like their care and help them become more comfortable and less stressed. And then coordinating multidisciplinary care is also really important to make sure that many aspects of a patient's needs are being met. And when healthcare professionals recognize the beliefs and values of the family and the patient, it also helps create an amicable environment in which families feel like they can communicate and be honest and exchange their thoughts and emotions with their providers. So all of these will help provide positive healthcare encounters that can potentially improve the psychosocial states of DMD patients and their families. Um, yeah, it's more than just therapy and coping, but it's also attitudes and mindsets as well. And it is a coordinated effort between healthcare professionals, families, and patients in order to create an environment in which everybody feels comfortable and everybody can communicate. Next, Suyash will be talking about family involvement and counseling benefits, while Diane will be talking about alternative remedies, current limitations, and future directions. But thank you for listening to the first part of this look into the psychosocial aspects of Duchenne muscular dystrophy.
Hi, my name is Suyash Rizal, and today I'll be talking about family involvement and counseling benefits of how DMD patients deal with their condition from a psychosocial aspect. So, the first question really is, how does a patient's family typically get involved in counseling, and how do they get involved? Well, families get involved in counseling for DMD and other similar conditions. This is usually after they discover the mother's potential for being a carrier for the DMD gene, in which case, genetic counseling is highly recommended. This counseling is often done either before or during pregnancy, and it includes disease diagnosis, its course and severity, exploring treatment options and their limitations. Family involvement into these counseling sessions will also help the patient and their loved ones cope with developmental challenges. So, what exactly happens during these genetic counseling sessions? Well, these sessions are guided by genetic counselors, also known as CGCs, or they can also be guided by doctors, nurses with special training in family health. So, during these sessions, the counselor will analyze the family health history of the patient and the patient's parents and their ancestors, and they will try to forecast how the genealogy affects the patient's current and future life. Uh, the patients will have to take tests to check for specific genetic conditions, and the patient's parents will also have to do these tests in order to track down family history and medical records. In the case of DMD, the mother will be screened to check for any X-linked genetic disease. This can be done before pregnancy, or it can also be done after pregnancy. Having this knowledge will prepare and help the family for any oncoming challenges. The genetic counseling sessions will reveal the baby's risk for possessing genetic conditions, in addition to helping families make responsible decisions about the baby's health. Usually, the counselor will also refer the family to medical specialists, educational resources, and support groups that focus on the conditions. In this case, it's DMD. Uh, by doing so, this will help several families to feel much more connected to each other and to the world around them. And this will help them prevent adopting feelings such as isolation and stress. Now, the question is, who is this counseling really advised for? Um, so, it's usually recommended for anyone that has a genetic conditions or believe that they may have an undiagnosed condition due to family history or any specific symptoms. People who have children with genetic conditions or have had multiple miscarriages are also highly recommended to seek genetic counseling. Next, if a woman becomes pregnant past the age of 35, they are advised to attend counseling. This is because an older women are more likely to experience unusual childbirth events and to have a baby with a birth defect. The baby's genetic health can often be checked using ultrasound or prenatal tests, which can provide us information about potential risks. Thus, genetic counseling sessions would prepare the parents by giving them the appropriate information. Genetic counseling is also recommended if a person's career, lifestyle, or medical history increases their child's risk for a mutation. For instance, working in a laboratory with specific chemicals or being exposed to radiation can trigger gene mutations. Counseling is also highly recommended for families that practice inbreeding, which significantly increases the risk factor. The image shown here is from a scientific study, and it basically shows how the X-linked gene is passed down over generations and how their child is affected with the DMD gene. Next, we'll talk about the effects of counseling for patients and families. So, what are the benefits of counseling? Well, the very first thing that comes to mind is that uh, DMD patients will often face emotional challenges and they'll feel a severe loss of connection to the world due to their disability. The patients may experience depression and they may feel isolated. Counseling, in this case, will help the patients learn to be resilient during the tough moments of their lives when everything around them, both physically, socially, and emotionally, are changing extremely rapidly. Counseling will also help to monitor and regulate the patient's moods and feelings in order to better help them psychosocially. According to a study, counseling can actually lead to a significant reduction in general anxiety and increased accuracy of perceived risks. This can lead to the patients feeling much more comfortable in their own bodies. Counselors are also often determined to make the patients feel that people with DMD will show steady developmental progress, despite them having an increasingly non-ambulant lifestyle as the years go on. The counselors will try to achieve this by assuming that the patients will have the capacity to lead fulfilling lives, pursue their interests, and develop social relationships. Now, how do you think that the patient's emotional health impacts him psychosocially? Well, according to a study by Dr. Polikoff and colleagues, it shows that physically handicapped children are at a much higher risk for experiencing significant emotional and behavioral problems, almost by up to 20 to 30% higher. This is a huge and significant number. patients will face several anxieties, uncertainties, and they would fear the idea of premature death. This is something that not even adults should have to go through. The great level of emotional stress correlates with a higher level of distress in the patient's caregivers as well. So, the patient's emotional health will affect their family stress, their social relationships, and their own mental health. According to another study by Dr. Zatz, it showed that the women who were identified as carriers for DMD were significantly less likely to even have children due to their desire to not pass on their genetic mutations. These findings collectively just show that counseling is an extremely important resource and it's very useful for genetic, behavioral, and emotional aspects of dealing with DMD. In fact, another study actually shows that 65% of patients and their parents actually claimed that counseling was a necessity rather than an option. This was especially true for parents of older children.
As such, patients with DMD are affected both physically and emotionally due to their illness. While the aforementioned therapies, coping mechanisms, and changes in attitude and perspective are great methods to remedy the psychosocial effects of DMD, there are additional resources available in the environment in which the patient operates that can accommodate their neurological, behavioral, and emotional disabilities. Dr. Polakov's study also indicates that patients with DMD commonly experience cognitive learning and attention disorders. Some boys with DMD even develop autism, which further deteriorates their social confidence by promoting social anxiety. Given that there is a limitation to the extent to which psychological counseling and therapy can touch upon these external influences of DMD on the patient's life, there are numerous local resources, like schools, that mainly revolve around the day-to-day lifestyle of patients that can better suit and accommodate their needs. According to Section 504 of the American Disabilities Act, no one with a disability can be excluded from participating in a federally funded activity, including schooling. In addition to the physical accommodations that schools can offer, such as wheelchair ramps, specialized desks, and other assistive technology, schools can offer an individualized education program that better allows patients to access the school's curriculum. The IEP also includes occupational therapy, speech and language therapy, as well as school-based counseling on school grounds to help students with DMD better adjust to the learning environment and follow the school's curriculum despite their cognitive difficulties. Additionally, patients can take a neuropsychological examination for a better, more comprehensive understanding of their individual cognitive, emotional, social, and academic skills that may have been affected as a result of having DMD. These neuropsychologists will produce results that will allow patients and their families to more accurately quantify their skills, which will allow them to better determine the accommodations that they may need and track their progress over time. There are also support groups that help the DMD patients help each other better cope with their emotions and behaviors, as well as the patients' families and resources in the larger community that will provide lifestyle and career support. Despite the increased number of studies and awareness of the need for psychosocial support, currently there are limitations in the field of psychosocial and therapy mechanisms that need to be further studied and analyzed. Previously, research into the psychosocial effects of DMD and its subsequent treatment mechanisms have been based on small samples that may not have been representative of the larger DMD population. Previous studies have also used minimal matched control groups, which is frequently used to calculate and quantify the relationship between the condition and the illness itself. Thus, past studies into psychosocial therapy have used normative samples and produced results that do not accurately differentiate between individual differences and the direct consequences of DMD on the patients. On the conceptual level, it has only recently been understood that the lack of dystrophin in DMD patients also influences the brain and subsequently affects the central nervous system. It is still unclear how these changes in the nervous system affect cognition and behavior in the patients. Therefore, despite the advancement in studies of DMD, its treatment mechanisms, and the need for psychosocial remedies, this field still has loopholes that need to be further studied to better improve treatments, especially as increasing numbers of patients with DMD are expected to survive into adulthood. In the future, studies in the field of psychosociology should conduct studies with matched control groups and samples that are more representative of the current DMD population. These studies will allow for the development of a more accurate measure to quantify cognitive function in patients with DMD and lead to more suitable treatment mechanisms and remedy programs. Researchers also believe that future studies should be more considerate of the age differences in patients with DMD to better understand the psychological, social, and cognitive effects of the disease at different stages of one's life. Until now, we have focused extensively on determining the mechanism of DMD and using this knowledge to develop clinical therapies to better the lives of patients. However, given the number of studies that indicate the extent to which DMD affects patients' psychological, social, cognitive, and behavioral aspects, we need to acknowledge the need for psychosocial consultation in line with clinical therapy. There are still lots of loopholes and gray areas in this field that need to be further analyzed for better treatment strategies. Given the extent of expertise and the number of support groups as listed, we hope that DMD patients are able to receive sufficient and adequate psychosocial treatment in the near future.